Why are we so lonely? 4 ways to increase our social connection with U.S. Surgeon General Dr. Vivek Murthy. What is the irony of loneliness? The fact that so many people experience it, yet it often feels like we're the only ones. Hi Psych2Goers, my name is Dr. Vivek Murthy, and I'm the 21st Surgeon General of the United States. Today we're going to be discussing the epidemic of loneliness and what to do about it. As a nation's doctor, I've traveled across the country and heard from people of all different backgrounds. One topic I heard about over and over again was loneliness. That's why I released a Surgeon General's advisory on our epidemic of loneliness and isolation to call attention to this public health threat that often is overlooked. So why are we lonely? And what are some effective ways we can increase our social connection? Let's dive right in. Why are we so lonely? In recent years, studies have found that as many as 1 in 2 adults in America report experiencing loneliness, and that loneliness among young people was even higher. Over the past few decades, in-person social time and community participation have declined. The average number of close friendships has fallen, and personal social networks have shrunk in size. These trends are driven by many factors, including changes in societal norms and technology use. COVID-19 further exacerbated these trends. As a result, many Americans today report experiencing loneliness. Loneliness is much more than a bad feeling. Being socially disconnected can increase the risk of serious physical and mental health conditions for both individuals and communities. On the flip side, social connection can be protective and is associated with positive physical, mental, and cognitive health. The good news is that by taking small steps every day to strengthen our relationships, we can increase our social connection so we can be less lonely, and in turn, we can help improve our health. Here are 4 things we can do to increase social connection. Develop and maintain your social network. Having regular contact with family, friends, and community members and social groups can help you build and maintain important relationships in your life. Remember, social connection is about the quality of your relationships. This is much more important than quantity. Invest time in nurturing your relationships with consistent and frequent engagement. Take a few minutes each day to reach out to a friend or family member. It could be giving them a call, stopping by to see them, or sending them a message to let them know you're thinking of them. These small actions, when done consistently, can help you feel more connected and less alone. Also consider joining social and community groups in your area. From fitness and hobby groups to service organizations, participating in group activities can foster a sense of belonging, meaning, and purpose. It can also introduce you to a new community of people. Overcoming loneliness can seem daunting, but remember that small steps make a big difference over time. What matters is taking the first step. Give and receive support. One powerful way we can create connection in our lives is through service to others. Simple acts of kindness and generosity help us feel connected to others and remind us that we have something to offer the world. This could be helping a neighbor, supporting a friend who's having a tough time, or volunteering in your community. Asking for help yourself is important too. It can be difficult to ask for help, but your friends, family, community members, and healthcare providers can be vital sources of support, and you'll be surprised they are often much more willing to help us than we think. Strengthen the quality of your social connections. Focus on making your time with others really count. Remember, quality matters more than quantity. When you are with people, give them your full attention by minimizing distractions during conversation. For instance, set aside your phone when spending time with others in person, and commit to not browsing on your phone or computer during virtual conversation. A few minutes of fully present conversation is often much more fulfilling for both people than a longer, distracted conversation. Also, be sure to ask questions and make it a point to listen as well. This helps other people feel seen and valued. And if you sense someone is hurting, err on the side of checking on them. You never know when an expression of concern and care can make a difference in someone's life. Finally, you can reduce unhealthy social interactions in your life by reducing excessive social media use and the time spent in unhealthy relationships. Talk with a healthcare provider. Talk with a healthcare professional if you are struggling with stress, loneliness, or social isolation. It can be daunting to reach out for help, but I believe it's a sign of strength to reach out and express when you're feeling lonely or isolated. Being open with those who care for your health about significant social changes in your life may help them better understand your health needs. Whether you are reaching out to a family member, friend, counselor, healthcare provider, or the 988 crisis line, know that there are people around you who are ready to help. For many of us, the issue of loneliness and isolation is a personal one. Almost all of us know someone in our lives who is struggling with loneliness. I've seen the consequences of loneliness up close in my own life and in the lives of so many people I've spoken with across America during my time as Surgeon General. As a father of 2 young kids, I want to ensure that my children grow up in a world where they have healthy relationships and a strong sense of community. If and when they do struggle with loneliness, I want them to know it's okay to ask for help. I want that for all of our kids. I hope that together we can create a world where loneliness is replaced by social connection, a world where we harness the potential of human relationships and connected communities to help us live healthier, happier, and more fulfilled lives.